All right. Again, welcome everybody. My name is Steve Whisler. I'm the manager, Military Relations and Field Services for the Johns Hopkins US Family Health Plan. Thank you so much for joining us this evening. And before we get started, I'd like to take an informal poll. If you are not a current member of the US Family Health Plan, if you could just signify by either raising your hand in the chat window and or just typing in no, I'm not a current member. I would really appreciate that. That would give me an idea of how I can structure the conversation. And I want to make sure that we address issues for those folks that are currently members and also for those folks who are interested in learning more about the U.S. Family Health Plan option. So again, I'm Steve Whisler. I've been in the plan here now.
Steve, you have some people who are just on by phone.
Right. Okay. Okay.
So I'm not sure how to type something into my phone.
Okay. No, that's okay. But thank you for letting me know. Okay, so again, thank you so much for those of you that identified as not current members, but prospective members. I appreciate that. So again, what I will say is on the next slide, I want to show you the agenda for what we're going to talk about this evening. Again, I'm Steve Whisler. I'm the manager for Military Relations and Field Services. And we're going to talk about these topics. Tell you some great news about the U.S. Family Health Plan for current members. I'm going to give you some key facts about the open season process that you and I are forced to follow. And we're going to talk about some of the most common Tricare options that we have as Tricare beneficiaries. We'll talk a little bit about qualifying life events and how those QLEs give us flexibility to move in between the two major Tricare plans. And then we'll address some frequently asked questions. We'll go over some really important points, particularly for those folks that are retiring from the military or changing their military status, those folks that might be planning to have a baby, et cetera. And then we'll also talk about the dental and vision options we have as Tricare beneficiaries. And then we'll finally end it up with why you might want to consider joining if you're not already a member and how. And then we'll take your Q&As at the end. All right, so let's start off with some really great news. If you're already a U.S. Family Health Plan member and you enjoy the benefits that you currently have now, you don't need to take any action whatsoever. Current U.S. Family Health Plan members will be re-enrolled automatically. There are currently about 50,000 members in our network enjoying services from 16,500 doctors with every major hospital in our region that is in our network. And so we thank you for being a member, and you know firsthand just how valuable this healthcare option is. I've been in this option myself since I retired from the Navy in 2006, and my family members have enjoyed this option even when I was on active duty as early as 2001. So thank you for that. And so great news, you don't need to re-enroll if you like it. And then conversely, if you're not a member of our plan and you like the current plan you're in, whether that be Tricare Select or Tricare Prime, and if you enjoy those services you get now, you don't need to take action if you want to stay in the same plan. So I want to make sure folks know that. Some of the key facts about the open season process. Congress passed legislation last year that requires us to follow a civilian model of open season. And so our open season plan mirrors that of the federal government and most major civilian healthcare plans. So we have this year, November 11th through December 9th is the time of the year that we have the option to change our plan. And just so you know, open season only applies to two major Tricare options. That is Tricare Prime and Tricare Select. So, and if you choose this plan, you will be locked into that plan for a year, for the calendar year, unless you have a qualifying life event. So again, other Tricare programs that are not affected, Tricare for Life, Tricare Young Adult, Tricare Retired Reserve, and Reserve Select. If you fall into one of these programs or eligibility requirements for these TRICARE programs, you can enroll in these options at any time. So again, if you become 65, you can enroll in TRICARE for life. If you get out of the military and join the reserves, you can join TRICARE Retired Reserve and TRICARE Reserve Select at any time of the year. So again, open season only applies to TRICARE Prime and TRICARE Select. This year, I put this slide in the briefing because one of the most common questions I get out in the field is, what are our options? So this year, I've put a really busy slide on the screen, and I'm going to walk you through it so that you really understand it. But we as TRICARE beneficiaries primarily have two major options. We have either TRICARE Select or we have TRICARE Prime. So let's talk about the options we have as TRICARE beneficiaries. First of all, on the left, TRICARE Select. It is a self-managed PPO plan, a preferred provider organization plan. In PPO plans, you typically do not have a primary care provider, you don't need referrals, and you're on the hook to find your own doctors, and you're also on the hook to make sure that the doctors you choose are in the TRICARE network and they accept TRICARE. This freedom and flexibility comes at a cost. There is typically a deductible, and most of the time you have a copay and a cost share that can be as high as 20% or more, depending upon the services you get. You can use the military treatment facilities to fill your prescriptions, and if you ever use a civilian location to fill your prescriptions, you will have copays associated with that prescription refill. And if you choose TRICARE Select, that is a free option. So again, TRICARE Select is one of our major options as a TRICARE beneficiary. And if you are an active duty family member, that cap or that out-of-pocket cap is $1,000 if you're an active duty family. And if you're a retired family choosing TRICARE Select, your out-of-pocket cap is $3,000 a year for your family. So again, that's TRICARE Select. The other major option we have around the nation is TRICARE Prime. And TRICARE Prime is what most military families have used and use today. In the middle column, TRICARE Prime, using the military treatment facilities is the most common method that folks use when they use TRICARE Prime. They get their care at the military treatment facility, and they have a primary care provider. It is a managed care option that requires referrals. And when you can be seen on base, you see that military doctor. And if you're a retiree, you don't pay copays. But if you happen to be referred out in town to use civilian doctors, then retirees will pay those copays. And so a lot of you are familiar with that if you're currently in Prime. The nice thing about TRICARE Prime, if you use the military treatment facilities and the Humana Military Network, is that you can still use the basis to fill your prescriptions, and whenever you use a civilian provider to fill those prescriptions, you will pay a copay. And so with TRICARE Prime, there is an annual enrollment fee for retired families, and the out-of-pocket cap still applies with TRICARE Prime. It's $1,000 out-of-pocket cap for active duty and $3,000 out-of-pocket cap for retirees. And so let's get into that third option, that far right column that you see highlighted. That is the U.S. Family Health Plan. And I come across so many families today that do not know that this is an option. They think it is a civilian plan. They think that the mail that we send out is from a civilian organization trying to sell them a civilian policy, and that could not be further from the truth. The U.S. Family Health Plan is a bona fide military TRICARE option that is only offered in 6 regions of the country. And the reason why folks don't know about this third option is because they've never been in an area where it's offered. Well, fortunately, if you live in the Mid-Atlantic from Northern Virginia on up in the DC capital region, and that includes Delaware, Southern Pennsylvania, you are eligible for this option. This option is a TRICARE Prime option with all the same TRICARE Prime rules, all the TRICARE Prime costs, and all the TRICARE Prime copays that you currently pay if you use civilian doctors. So since you will always use civilian doctors in the Johns Hopkins network, you'll pay copays if you are a retired family. And again, if you are an active duty family member using this option, you will never pay a copay for regular doctor visits and specialty care. And again, that is if you're an active duty family member, no copays. This option was created so that folks do not use the military treatment facilities for care. Congress created this option so folks could use the civilian option and allow the MTFs or the military treatment facilities to focus their services on active duty personnel. So if you choose the U.S. Family Health Plan option, you must use Walgreens to fill your prescriptions. So again, if you choose the U.S. Family Health Plan option, only Walgreens can fill your prescriptions. And so that's really the basic overview of our most common TRICARE options. So if you have any questions on this, we can address those later on in the presentation here. So let's talk about qualifying life events. You can switch between TRICARE Select and TRICARE Prime, or the U.S. Family Health Plan, outside of open season if you have a qualifying life event. TRICARE has broken down our qualifying life events into two categories: military changes and family changes. So if you're a military family and you retire from service, or if someone is injured on active duty, or if you move or do a PCS, a permanent change of station, to another location, you are allowed to change TRICARE plans within 90 days of that transfer or of that qualifying life event. Conversely, if you have a family change, such as getting married, getting divorced, having a baby, having children, a child going to college, you can make changes to your TRICARE options within 90 days. And the beautiful way this legislation was written is that if one person in your family experiences a QLE, anyone in the family can make changes within that 90-day period. So if little Timmy goes off to college, mom and dad can also change their TRICARE options if they want. So again, that's a qualifying life event. And you are allowed to make changes as long as you act within that 90-day period. So let's talk about some frequently asked questions. If I'm locked into a plan for a year, can I change my primary care doctor and location throughout the year? And the answer is yes. If you're a U.S. Family Health Plan member, one of the great facets of our program is that you choose your doctor. You choose whom you see and when you, what specialty care office you visit, as long as they're in our network. So you always have the option to change doctors anytime that you're enrolled in our plan. You don't have to wait till open season to change doctors. Another question is, if I change plans, when will coverage start? The good news is, if you're already in Prime, TRICARE Prime, getting your care at the military bases, you can switch to U.S. Family Health Plan at any time, even outside of open season, because the U.S. Family Health Plan is a TRICARE Prime option. So if you want to switch from TRICARE Prime, you can switch to the U.S. Family Health Plan at any time throughout the year. You don't have to wait. But if you do switch to our option during the open season period, you can choose whether to have your plan start 1 January, or we can backdate it to the actual time that you want to change. If you experience a QLE during open season, you can actually have your coverage start backdated to your qualifying life event date, such as the birth of that child or someone going off to college. Another question I get out in the field is whether or not everyone in the family must choose the same option. And the answer is no. There are many examples out there where folks in a family have different TRICARE options. One of such example is maybe mom, she retires from the military and she wants to stay at the military base for care. She can enroll in TRICARE Prime and get her care at the base. Maybe dad wants to enroll in the U.S. Family Health Plan, and dad can choose the civilian doctors within the Johns Hopkins network, and he can be enrolled in U.S. Family Health Plan. And then if their son goes to college, their son can be enrolled in TRICARE Select at the college that he is attending out of state. So there are many examples where families can choose and tailor their TRICARE options. So if you want to do that, give one of our folks a call and we can help you through that process. And then finally, must I enroll in a TRICARE plan every year? And the answer is no. If you enjoy the TRICARE plan you're in, whether it's TRICARE Select, TRICARE Prime at the bases, or the U.S. Family Health Plan, you'll be re-enrolled in that plan you selected every year if you take no action. So, but again, you may need to enroll in a new plan if you experience a qualifying life event, such as retiring from the military, moving, moving out of the area, or having a child, etc. So again, if you ever have a doubt, give one of our folks a call, and we can help you out through that process. So another frequently asked question is, I have other health insurance. Why should I even use TRICARE? I get this question a lot from retirees. Retirees often work for contractors or the federal government after they retire, and I find that they spend a lot of money every month on those civilian healthcare plans. And the question I ask is why? Because your TRICARE benefit, if you are a retiree, is just $594 a year for a family of two or more. So I run across many families that pay not just $594 a year, but they're paying that much and maybe more per month. So if you are a retiree and you are using a civilian healthcare plan, I urge you to seriously look at whether or not that's a viable option for your family, because you have a great TRICARE benefit that you've earned and can use. And U.S. Family Health Plan is a great option for you to choose because, again, we have an extensive network of doctors all throughout our geographic service area. So for active duty members, I urge you to consider the U.S. Family Health Plan because your TRICARE benefit is free if you select the U.S. Family Health Plan. Again, the only thing that U.S. Family Health Plan members will pay for are those prescription drug copays. And so one of the questions I see from our forum is, what is the oldest age that will cover children? So let's talk about how TRICARE benefits change for your kids as they get older. And I put this on the screen specifically because we get that question quite a bit out there in the field. So let's talk about this. First of all, your children will lose their TRICARE benefits if they ever marry, no matter their age. No matter their age. So that's one really important thing to consider. If kids also work for an employer that offers a healthcare option, regardless of whether they take that option, they will lose their TRICARE benefits. So again, if they become a teacher, or if they work for a county government, or if they work for an employer that offers a healthcare plan, regardless of whether they take it, they risk losing their TRICARE benefit. So that's really the two major things that I see kids lose their benefits altogether. So benefits continue for our kids up until age 23, or they graduate, whichever's first, if they're enrolled in school full time. So if your child is enrolled, there's no additional cost, there's no changes, and if they are in our service area, they will still be under your TRICARE umbrella, so to speak, at no extra cost. So if your child turns 21, and if they're not going to school full time, or if they graduate and or turn 23, you can continue their TRICARE benefits, but it will come at a hefty premium per month. And that premium is $214 per month if they choose TRICARE Young Adult Select, or if they choose TRICARE Young Adult Prime or TRICARE Young Adult U.S. Family Health Plan, that cost will be $354 per month. So again, per month per child. So as your kids age, be sure to give us a call. We'll walk you through the process. We'll talk with you about the options you have, and we'll help you make a determination as to which TRICARE Young Adult plan is best for you. But I will say that if your children turn 26, all TRICARE benefits end for our kids when they hit 26. There are a few exceptions if there are significant medical issues that your children experience. There are exceptions where they can retain their benefits, sometimes as long as they live. So if you have that issue, give us a call, or you can call tricare.mil. Give those experts a call, and they can tell you all of those options for you. And then last but not least, one of the major frequently asked questions I get out there in the field is, how does TRICARE benefits work with my VA benefits? So I will tell you, if you are a service disabled veteran, if you have a VA disability by the, if you have a service disability designation by the VA, you can use your VA benefits concurrently with your TRICARE benefit, whether it's TRICARE Select, TRICARE Prime, or US Family Health Plan. They do not affect one another. So it is very important to know that you can use them simultaneously. I personally use both simultaneously. So if you have any questions about your VA benefits and how they work with US Family Health Plan, you're welcome to give me and my staff anytime, give them a call anytime, and we can help walk you through that process and how you can maximize both benefits for your family. So those are the frequently asked questions I've done. Let me look at the screen here and see if there's anything else. So somebody asked, what is the oldest age to cover for a child? We've already covered that. And then someone said, how do you switch from US Family Health Plan to TRICARE Select during open season? So again, the question was, how do I switch from US Family Health Plan to TRICARE Select? So if you want to switch from the US Family Health Plan to TRICARE Select, you have to wait until open season, which starts November 11th and ends December 9th. You can contact tricare.mil, and your plan would be effective 1 January. So again, if you have any questions about that, you're always welcome to call us as well. Another question I see is, do enrollment fees need to be paid up to date to be renewed for January 1st, 2020? So I'm not really sure about that. It really depends on circumstances for each family, but typically, if you call to enroll for the US Family Health Plan, we will typically ask for 3 months of enrollment fees up front. And again, if you're a family of 2 or more, it's $49.50 a month. It's half of that if you are a single person, but we typically ask for 3 months in advance, and then we will work with you on other convenient methods to remit your annual enrollment fee. And that again, TRICARE enrollment fees are for retirees only. And so our strongest recommendation is that you have TRICARE Prime enrollment fees taken out of your retirement, because DFAS will automatically adjust those amounts from year to year as TRICARE Prime enrollment fees increase. And just so you know, TRICARE Prime enrollment fees adjust with our cost of living allowances. So if Congress gives us, say, a 2% COLA, our TRICARE Prime enrollment fees go up 2%. TRICARE Prime enrollment fees are tied to our COLA. So again, a couple of important points I want to highlight before we move on. Military.
Can we ask questions from?
Okay, I apologize. I'm back online here. So let's talk about some very important points. If you are a current active duty military family and you plan to retire during this year, it is so important that you re-enroll your entire family within 90 days of that retirement date. The rules have changed slightly in the last year. We have 90 days to take action. So it's really important that military members who retire re-enroll their entire family unit. So it has happened in the past where folks were automatically defaulted into TRICARE Select if they did not make a choice. But that option and that automatic default was removed in the latest National Defense Authorization Act. So again, if you're an active duty military member planning to retire, you must take action within 90 days and re-enroll your family. Also, if you move, if you change locations, if you PCS to a new area, you must re-enroll your family in that TRICARE option within 90 days of you rotating. So it's really important that you do that as well, because If you don't act, you risk being placed on a direct care category, meaning that you can only get care at a military installation on a space A basis. So again, I really want to highlight that for our current active duty military members. Also, for those folks planning to have a baby this year, I want you to know that your babies will be enrolled conditionally within the U.S. Family Health Plan if one of you is a current member. So your baby will automatically be enrolled on a conditional basis for 90 days. All bills will be paid, any bills incurred during that first 90 days of life. So that 90 days is a great buffer for you to contact Social Security Administration, get that new Social Security number for the baby, and then also get to your local pass and ID office to get an ID card for your child. And once that occurs, then give our enrollment office a call, and you can enroll your newborn and ensure that that coverage continues well beyond that 90-day period. So again, if you have any plans for a child, please give our staff a call and we can walk you through that process as well. Okay, so let's talk about dental and vision. If you're a current U.S. Family Health Plan member, hopefully you know about this great value-added service, and like me, you've taken advantage of that. Members receive 2 free dental cleanings every year, we also get a free eye exam every year. We have a host of Concordia Advantage PPO dentists in our network. Not all Concordia Advantage PPO dentists, but a good number participate in our network, and you can get those free cleanings every year. No referral required, no copay required, and it's a great benefit we have. We have an extensive network of dentists and optometrists you can use, and most of these locations will offer discounts for other comprehensive services, such as fillings, crowns, lenses, and frames for eyeglasses. These discounts range typically 10 to 15%. And again, these other services are available to you if you need them and if you feel like you don't need comprehensive vision and dental coverage. But what if you do want and need comprehensive vision and dental coverage? The last National Defense Authorization Act allows Tricare beneficiaries to purchase the same dental and vision plans offered to federal government employees. So a lot of folks don't know this, but even if you're not a federal government employee, you have the option to purchase one of the 4 vision plans and one of the 10 dental plans offered online at www.tricare.mil/FedVIP. FedVIP stands for the Federal Dental and Vision Insurance Program. So again, you do have our value-added services, those 2 free cleanings and that free eye exam every year. But if you need comprehensive dental care, if you need comprehensive vision care, that includes lenses and frames and whatnot, you are definitely allowed to purchase these other options online. And they have the same open season period that we do. It's November 11th through December 9th. And again, these plans become effective 1 January. And we do encourage you to compare these plans and costs with those plans offered by your employer. So again, we get a lot of calls about dental and vision, and we wanted to make sure that you were aware of that. So if you're not a U.S. Family Health Plan member, we urge you to think about it because there are a great number of reasons why you should join our plan. First of all, 16,500 doctors and specialists that you choose. You are never told where to go, whom to see. You have the option of choosing any one of those doctors in our network if you need them. A lot of folks think that if you join our plan, you have to go to Baltimore for care, and that is not true. Our extensive network is over Northern Virginia, all of DC, all of Maryland, Southern Pennsylvania, Northeastern West Virginia. You have an extensive geographic service area that you can choose from anytime you want. And it's nice to know that all of those doctors and specialists are credentialed by Johns Hopkins. You can choose these doctors near your home, or you can choose these doctors close to where you work. We have all of the preventative and wellness care that you get and that you experience with Tricare Prime and Tricare Select, and you have extensive prescription drug coverage with Walgreens. So again, trusted and stable healthcare offered by Johns Hopkins, great Johns Hopkins doctors and specialists. You can't go wrong. So if you're not a member, this is how you join. Again, you need to make sure that your information in DEERS is current. I have provided the phone number for you. If you need to contact DEERS, you can call them and verify your information. You can also go by your local military pass and ID office to update that information if you need to. Second, go online at www.hopkinsusfhp.org and use our Find a Doctor tool. Put in your zip code. Put in a 5 or 10 mile search radius, 15-mile search radius. Search for those primary care providers. Search for those specialists. Look for the doctor that you want to choose. We suggest you call that practice, verify their availability, and schedule that new patient visit. Next, call enrollment weekdays between 8:30 and 4:30 and enroll. It typically takes 15 to 20 minutes to do so. All they will require is the sponsor's social, the dates of birth for those that will enroll, and then again, they will ask for 3 months of your Tricare Prime enrollment fee if you are a retired or a retiree family member. And then lastly, call your local Walgreens. Have them transfer those existing prescriptions from your military treatment facilities or Express Scripts. And if you have existing drug authorizations with Express Scripts or that local military treatment facility, be sure to get a copy of those drug authorizations and provide them to our U.S. Family Health Plan customer service, because those authorizations you have are portable. They will port over to our program. That way you don't have to go through those processes again. So again, it's a really easy process to enroll. It's a great asset for you and your family. And the nice thing is, remember, we are a Tricare Prime option. So if you are in Tricare Prime, you can enroll right now. You can enroll tomorrow, and your effective date will be the day after that. So we really encourage you to think about that. Again, if you're a current Tricare Select member, you have to wait till open season to enroll, and your plan will be effective on 1 January unless you have a qualifying life event. So that's really it right now for the for my comments and remarks. I put the information on the screen there if you want to make a phone call and get more information, or you can always email me directly. And I would love to hear questions from the field or from the audience.
Steve, I had a question about Tricare.
All right, one of the questions I have from the field is I'm a current U.S. Family Health Plan member, and I will turn 65 in a few months. So what do I need to do? So if you are getting ready to turn 65, there are a couple of paths that we talk to these folks about. One is we have a few select segment of members. If you joined the U.S. Family Health Plan prior to October of 2012, you have a couple of options. So let me put that on the back burner. Let me talk about those folks that joined after October 2012, because that'll be easier to address first. So if you joined the U.S. Family Health Plan after October of 2012, this is what happens when you turn 65. When you turn 65, you'll get a couple of letters from the government. One will be from Social Security saying that you need to start purchasing Medicare Part B. So you will soon purchase Medicare Part B. And the second letter you'll get will be from the federal government, the Department of Defense, saying it's time to come in and renew your ID card. And so when you go in to renew your ID card, typically about 3 months before it expires and before your 65th birthday, you'll be required to show them your Medicare Part B card that proves you're buying it, and then you will be enrolled in Tricare for life. So again, if you enrolled in our plan after October 2012, you'll be disenrolled from any Tricare option you have. You'll be forced to buy Medicare Part B, and then you will get Tricare for life when you purchase Tricare, when you purchase that Medicare Part B. Medicare pays 80% of your medical bills. Tricare for life covers the other 20%, as well as your prescription drug benefit. So that is what happens to our members that join US Family Health Plan after October 2012. This particular question we got came from someone who joined our plan prior to October of 2012. And for those folks that joined our plan prior to October 2012, they have a couple of options. Their first option is they can continue being in the US Family Health Plan beyond age 65. And they are not required to buy Medicare by law. But we recommend that you do buy Medicare. So that is one of the options. You don't have to buy Medicare. You can continue in the US Family Health Plan. You'll continue paying the Tricare Prime enrollment fee, and you'll be going on there. The risks of not buying Medicare Part B are extensive. One, Tricare Prime and Tricare US Family Health Plan does not cover everything. There are really significant health issues such as end-stage renal failure, such as kidney dialysis, where you need to be on Medicare to continue that coverage. So if you need Medicare coverage after you turn 65, you can't enroll in Medicare right away in some cases. So you may have a gap in coverage if you develop a significant medical issue. Number two, if you move out of our region and if you move to an area where the US Family Health Plan is not offered, you have to enroll in Medicare because, again, you can't continue US Family Health Plan in an area where it's not authorized. So again, if you move to an area where you need to buy Medicare, you may have to wait for coverage to start. And you may be forced to pay a 10% penalty for every year you did not join Medicare at 65. So it is really important that those folks that joined our plan before October 2012, it's really important, and our recommendation is that you buy Medicare Part B and continue your US Family Health Plan coverage because you can continue seeing the same doctors. All of Johns Hopkins facilities and doctors accept Medicare and Tricare for life. So hopefully that answers the question. And if you do have any questions about what happens when you turn 65, please give us a call, give our customer service folks a call, or give our staff a call. We will be happy to help walk you through it. Another question I have from the field is, must we use Walgreens? Can we use another pharmacy? Unfortunately, that answer is no. Our contract pharmacy is Walgreens. We have an extensive variety of Walgreens in our region, in our area. You can go to the US Family Health Plan website for a listing of all of our Walgreens facilities. And the nice thing is that Walgreens has a mail order system that is free as well. So you can have your maintenance medications sent directly to your mailbox and get 90 days worth of medicine when it's supposed to be there. I know I take advantage of it, and it's a great free service. All you pay is the prescription drug copays, and it's the same copays that you pay with Tricare Prime. Another question I got here is why is it important to establish a relationship with my primary care provider as soon as possible? So that's a great question. Why should I develop that relationship quickly as possible? So first of all, we encourage new members to schedule their wellness visit at their primary care facility as soon as possible. If you tell them that you're going to be a new member, they will get you in within 30 days. That is the requirement. And if that doesn't happen, give me a call and I'll help you get in there. So again, get in there, see that new provider. It's typically a 30 to 45-minute session. That new provider will get to know your health history, ask you all kinds of questions. You'll fill out forms to transfer medical records. We will issue you those referrals right there on the spot. You can ask your primary care provider for a recommended specialist, or you can do your research on our website at hopkinsusfhp.org. And if you find a specialist that you want to see, you can ask your primary care provider to write a referral to that specialist. Remember, in our plan, you always choose your doctor. So it's really important to establish that relationship as soon as possible. I've had the same nurse practitioner since I retired in 2006, and it's wonderful. I can use my chart. I can use our electronic medical system to send her emails, to ask for referrals, and the vast majority of my referrals are done online or with a simple phone call. So again, really important to develop that relationship with your PCP as soon as possible. Are there any more questions from the field? All right. Well, again, one more there coming in. Oh, we got a great question and something I forgot to cover. One of the questions that I got was, do I have other options other than calling in to enroll? And the answer is yes. We have a web-based form that folks can go online and enroll. I know that you can go to tricare.mil and select the web-based enrollment that way, but you don't have to call in. You can actually use our web-based enrollment process to enroll. So again, that's a great option that you can do as well. Thank you for that question. All right, any more questions from the field? All right, well, I see none. So again, thank you for attending tonight. Give us a call, give us an email, and we look forward to you joining the U.S. Family Health Plan. Have a great day.